high PTH will stimulate the osteoblast, will release the rank ligand, which will attach to the rank receptor osteoclast, will cause their activity, causing bone resorption. Since the osteoblastic proliferation is also more, the bones can have osteoblastic whitish lines too, called as the rotting fence post appearance. The lytic cavities in the bone, they are filled up with blood, and the blood degradation products gives it a brown color, called as brown tumor. These lytic cavities are also called as cyst, filled with fibrous tissue, so fibrosa cystica in the bone, osteitis fibrosa cystica. There are dots on the skull, called as salt pepper appearance. There is loss of lamina dura. What is lamina dura? It has got nothing to do with lamina or dura. We'll talk about it. And very rarely avascular necrosis. So, when I look at the tooth, the lining of a tooth socket, this is called as lamina dura, and in hyperparathyroidism, this lining is gone. So a small tooth can help you diagnose with multiple conditions. Enamel defect plus widening rickets. Dentine defect plus bleeding of gums. Scurvy. Dentine defect plus multiple fractures. Osteogenesis imperfecta. Loss of lamina dura with lytic cavities. Hyperparathyroidism. So small tooth can help you diagnose 4 diseases. Remember that. That's how the salt pepper skull with dot on the skull looks like. That's how the whitish bones, rotting fence post appearance looks like. This is the lytic cavity in a bone, osteitis fibrosa cystica, and when it's brown because of the blood degradation product, called as a brown tumor. Remember, short fourth metacarpal, seen in Turner syndrome or pseudo hypoparathyroidism. This slide gets a memory of a fantastic South Indian actor, Kamal Haasan. He got National Award for the movie Appu Raja. He had the double role in it. The short-headed Kamal Haasan was being a patient of achondroplasia. The trunk size in achondroplasia is normal. The limbs are short because it's a defect in enchondral ossification. I am sitting and this gentleman is standing. Our heights are still comparable. They are happy people. I'm smiling, always smiling, and he's also smiling. Other diseases in which you have smiling babies are Down syndrome and Angelman syndrome. Achondroplasia is a defect in the fibroblast growth factor receptor 3 mutation. In achondroplasia, the intelligence is normal. Even in the movie Appu Raja, the short-headed Kamal Haasan was more intelligent. The limbs are short. There is a trident or starfish hand. This is a trident hand. Gap between the ring and the middle finger. Many people are not able to do that. I'll just have a word about it. And then champagne glass pelvis, which is a wider pelvis than the depth, and bullet-shaped vertebrae are seen, which comes as an image to you. So this is the champagne glass pelvis, wider one, looks like a glass of champagne, and that's how the bullet-shaped vertebra look like. Limb dwarfism, enchondral ossification defect, trident hand, starfish hand, all the fingers equal size, like the fish, starfish hand. When I remember, there was always a question that was asked in entrance exams about the dermatomes, and I used to show that this is a way to remember the dermatomes. The thumb is supplied by C6 nerve root, index and middle finger by C7, ring and little finger by C8. In hand, C5 and T1 do not have sensory supply. I used to teach that in the class. And somehow 10% of the general population can't do that on the right side. And those who can't do on the right side, out of them, some can do on the left. But some people, they're not able to do that. The reason unknown. So sensory supply of hand. In All India 2012, there was a question asked. Sensory supply of thumb and index finger are supplied by which nerve roots? So according to my way of remembering, answer was C6, C7. So one of the students in the middle of a night wrote, "Sir, what's the answer?" So I wrote down C6, C7. Then a student said, in Harrison and Gray's Anatomy, this image is given. C6 for thumb and index finger, C7 for middle, ring and little finger, C8. I was telling this. Now which one is correct? I went down and looked in the books. There was one more. 1, 2, 3. Which is correct? So this is what the dermatomal distribution talks about. So system 2, 6 is for thumb, C7 for index and middle finger, C8 for ring and little finger, as compared to this system, which is system 1. Remember, it is the system 2 which is the preferred system. This is the way that, remember, trident hand. In lower limbs, the system is same for both the nomenclatures given. L4 is medial aspect of leg and foot. L5 is the dorsum aspect of foot. Great toe all around. S1 is the sole of a foot, little toe all around. So that's how L4, L5, S1 supply. So L4 medial part of leg and foot. L5 lateral part of leg, dorsum of great toe. S1 sole and the fifth toe. Short fourth metacarpal, I told you, Turner syndrome and pseudo hypoparathyroidism. When there is defect in intramembranous ossification, the skull, that is the cranium, the clavicle, that is cleido, the important bones developed from the intramembranous ossification are defective. So the shoulders will meet in the midline. Absent clavicle, classical. This is cleidocrinial disorder, autosomal dominant condition. Most of the orthopedic conditions are autosomal dominant. Metabolic disorders are autosomal recessive. There is intramembranous ossification defect. There is absent clavicle. Shoulders can meet in the midline. Flat face, delayed dentition, spine disorders, and coxa vara. Coming to this article by Karan Thapar. Doctors are precious. There's nobody best in the world, but then doctors have something special. It's important that all of you listening to me have reached where you have reached today. Congratulations. If you are a lawyer, you can be efficient. If you are a social worker, you can be humane. But if you are a doctor, you are a combination of humanity and efficiency. So rare. And all the best that you people have a desire to go ahead and super specialize. When I look at the motivation word, we all need that. But you know what? Doctors are the motivated lot in themselves. They are the people who are filled up with energy. They are the people who are trying to save the most precious gift of God, life. I remember one of my schoolmates, he had thrown a party. He had bought a very good car. And I went to Connaught Place. I had purchased a car not as good as his car, but my car was new and precious to me. I parked the car in front of the restaurant. When I went up, we as doctors have less number of friends, precious but less. We as doctors in the parties are very quiet, not so jumping types. I saw a lot of energy in my schoolmates, ex-schoolmates. But as I sat down in a corner, was enjoying my Coke. Suddenly a man came to me and said, "Hey Apurv, what happened to you?" I asked him, "What happened to me?" "I wanted to be an orthopedician. I'm a teacher. I'm enjoying. I'm good." He said, No. I just saw the car you're driving. Look at this guy who used to look at your notes. Look at where he has reached. He has 2 houses in South Delhi, fantastic industry, a restaurant and 2 good cars. Where you are?" I said, "Why don't you ask my friend?" And you know, these type of people, they're called a yo-yo man. They will come and poke. So he went to one of my friend. And after some time when he came back, his face was red. I knew that my friend had spoken because he was my friend. I asked him what happened. He said that your friend said, even if I have 10 bungalows, I won't have 10 fingers of a doctor, which, without knowing the level of the caste or the religion or what kind of human he is, will try to save him, work for improving his life. In spite of having many industries, many cars, many restaurants, I can't have a heart that prays for a human life that a doctor does, and can't have a brain that integrates between the heart and the fingers to save and improve. He looked at me and he said, "I'm sorry. Remember, next time if somebody asks you, what do? Hold your head high, get a smile on your face, broaden your shoulder, and speak like a lion. I am a doctor, and I can make a difference. I am valuable, and I don't give up." That is what you are. You are a source of motivation. Point number 1 is to achieve a basic degree, but then you have to go beyond. Dream is a short-term realization of a bigger word, the vision. You have to keep a positive attitude, but what decides where you go is just not the hard work. It is the persistence in spite of failures. If you look at any city, and you look at the famous practitioners, if you look at their degrees, it will be like Diploma Gynae Obs, then MS Gynae Obs. So there is a journey. They didn't stop. They kept on going. Stay positive. End of the day, talk to yourself. An interaction with yourself is like a feedback system that improves you. Decide how you could have improved your day. Decide what you want to do the next day. Talk to yourself in the mirror. Are you doing what it takes for you to reach where you want to reach? Have respect for your college. Have respect for your profession. Most importantly, have respect for your nation. Always. Read this article. Once in a while, it'll get a smile on your face. Doctors are valuable. When I look at osteoclast defects, osteopetrosis and Paget's both are osteoclast defect. Osteopetrosis more than the Paget's. In osteopetrosis, the bone marrow is not there. So the bone looks white like a marble. But the shape of the skeleton is maintained. In osteopetrosis, it's a shiny white bone without a medullary cavity. So it is a defect in the proton pump carbonic anhydrase type 2. Bone resorption is defective. Marble bone disease is the name. It's a defect in the osteoclast. Since the marrow is not there, there will be pancytopenia, its component anemia, and related to 2 is the infections. There will be secondary hematopoiesis because of anemia, hepatosplenomegaly. Infections can involve anywhere, but classically they will mention about the mandible. I don't know why, but in the MCQs they say osteomyelitis of mandible. Think about this disease. The neural foramina are narrowed, involve the 2nd nerve, the 7th and the 8th. The seventh is colored because the commonest now. Bone healing is minus plus. Usually it doesn't unite, but some reports do claim it can unite. Treatment is bone marrow transplant, which is given intravenous. In osteopetrosis, since the marrow is not there, it looks like a bone within a bone appearance, which is also seen in sickle cell anemia. Or there can be horizontal stripes in the bone, classically seen in renal failures, can also be picked up in osteopetrosis. This is called as rugger jersey or rugby player. Their jersey has got alternate stripes of colors, rugger jersey spine, classical of CRF or renal osteodystrophy, also seen in osteopetrosis. The lower end femur looks like a flask, classically seen in Gauchers, also a feature of osteopetrosis. People love to ask osteopetrosis in the exam. Paget's is a high turnover disease, also called as osteitis deformans. Osteoclasts are defective, more turnover, more resorption, more formation. Age is more than 50 years, so 6th decade onwards. More common in males. P for Paget's, P for pelvis. P for Paget's, P for pain. Pain is the commonest symptom. Pelvis is the commonest affected bone. Calcium and phosphate are normal. Alkaline phosphatase is high. The diagnostic feature of Paget's is a cement line. There will be a bone formation. There will be a bone resorption. And in between the two, there is a junctional line which is called as a cement line. In Paget's, you have ivory vertebra. So, the entire vertebra will look like white colored. Or you can have picture frame vertebra where the boundary will be sclerosed. Or you can have cotton wool skull where it can be like a deposit of cotton wasp on the skull, calcified skull. There is high turnover, so osteosarcoma risk is 1%. Bisphosphonates are drug of choice. Calcitonin, which is more rapidly acting, is good to control the pain. So when I look at the Paget's, this is a picture frame vertebra, ivory vertebra, whole white, cotton wool skull, or you can have increasing hat size because the skull has deposits. So over time there's a thickening of the skull. So patient will say, I want to change my hats. So there is increasing hat size. Or there can be a big area of osteoporosis. Osteoporosis circumscripta. There can be a thickening of the iliopectineal line called as a brim sign. Or there can be resorption of the long bone cortex called as flame appearance or blade of grass appearance. This question comes in JIPMER many times. Coming to the other variety of metabolic disorders, and I'm asked this question very often: how do you differentiate between osteoporosis and osteomalacia? If I look at this pie chart, the yellow is a mineralized bone, red is unmineralized bone. In osteoporosis, the amount goes down. The ratio is the same. That's why calcium phosphate ALP is normal. Whereas in osteomalacia or rickets, the red unmineralized bone gets altered. That is why in this, the alteration that involves is there is decreased phosphate, normal to low calcium, high alkaline phosphatase, high PTH. These features are seen in osteopetrosis as well, but osteomalacia and rickets, classical features. Now, osteoporosis, the most commonly fractured bone is a vertebra, followed by the hip, followed by the cholis. There is decreased bone mineral density, which is measured on DEXA scan, dual emission X-ray absorptiometry, DEXA. When we look at DEXA scan, you calculate something called a T-score, in which you take a 30-year-old individual, right? Sex is always matched. Age matched is Z-score. Z-score, you will compare bone with the same age. T-score, you will compare with 30 years because At 30, you peak your bone, then you start losing it. T-score 0 to -1, normal. -1 to -2.5, we are going in negative osteopenia. Less than -2.5, osteoporosis. Osteoporosis with a fracture, severe osteoporosis, vertebra, hip and colis. Normal blood parameters. Remember, activity builds up the bone. Exercise builds up the bone because it triggers the osteoblastic activity. Inactivity resorbs the bone. So if there's a hemiplegia, you will lose the bone more in upper limb than the lower limb. That's why in hemiplegic patient, humerus, there is maximum loss of bone mineral density, followed by estrogen, bisphosphonates, calcitonin, and PTH. These are the drugs which are used. So the drugs which inhibit resorption, bisphosphonate, drug of choice for osteoporosis. They ask you postmenopausal osteoporosis, bisphosphonate. Calcitonin, again, both bisphosphonate and calcitonin, they directly inhibit the osteoclast. Denosumab and estrogen. These are two drugs which inhibits the rank ligand. Then comes the serum parathyroid hormone, PTH. PTH directly stimulates the osteoblastic activity, but it's in low doses. Low dose, 20 micrograms per day. Root, subcutaneous. Another drug which can directly act on the bone, fluoride. It increases osteoblastic activity and causes osteosclerosis. That's why when there's an area where fluorosis is endemic, you will have osteosclerosis, white skeleton. Fluorine also can cause intramembranous ossification. When you look at the X-rays of osteoporosis, it appears there is compression of the margins of the vertebra, as if in the intervertebral area there is a fish called as a codfish vertebra. Classical images which were asked in NEET 2018 and 2019. So this is the codfish vertebra. Intervertebral space looks like a fish. Classical of osteoporosis, also seen in bone softening disorders like osteomalacia. Drugs, again revising. Drugs which increase bone formation, fluorine, but it's uncontrolled, not preferred. PTH low dose is coming up. Subcutaneous route. Bisphosphonate, drug of choice. Calcitonin, denosumab, again a subcutaneous drug, denosumab, and estrogen. Calcitonin is nasal drops, remember that. And strontium acts on both the pathways, but because of cardiac side effects is not preferred. Fibromyalgia. There was a question asked about milnacipran. It's a drug being used in fibromyalgia. It's a diagnosis of exclusion. Chronic pain, mainly in the back for more than 3 months. Neuropsychiatric features of fatigue or mood disorders. More common in females. Reports are normal. Go physical activities. Give painkillers. Mood elevators. Duloxetine, milnacipran, amitriptyline are used. Gabapentin, pregabalin also help. Look at this image. White skeleton. We saw osteopetrosis. It was white, but the shape was maintained. Here, it's white, but crumpled skeleton. This is osteogenesis imperfecta. This is osteopetrosis. Osteogenesis imperfecta, also called as brittle bone disease or Lobstein-Volek disease, is a defect in the type 1 collagen. It's autosomal dominant. There is osteopenia. Bone unites at normal rate. Femur is the commonest bone to fracture. Osteogenesis imperfecta is the most common cause of multiple fractures at birth. It is associated with hyperlaxity and developmental dysplasia of hip. Blue sclera. That image can come in the exam. Associated with deafness and dentine defect. Silence was a man who classified it. Such a name only his wife could have given. Parents can't keep such a name. Treatment is gene therapy. Gaucher is another disease where gene therapy is given. OI is again a disease where gene therapy is given. Do read the table at Harrison that talks about diseases where gene therapy is advocated. Pathological fractures, you have Bailey rods. What is the advantage of Bailey rods? Their length can be increased. As the Bailey love, its volume increases every year. Bailey rods can be increased every year. This image can come, blue sclera. You have C. cava osteotomy, corrective osteotomy to correct the deformities in this disease. Codfish vertebra, osteoporosis. H-shaped vertebra, sickle cell anemia, remember that. Rugger jersey spine, renal failure, also in osteopetrosis. So look at the different spines put on the same page. Ivory vertebra means all white, or the boundaries being white, Paget's disease. Picture frame vertebra or ivory vertebra. Bullet shaped vertebra, achondroplasia. Codfish vertebra, osteoporosis more than osteomalacia. Bamboo spine, fusion of the spine, ankylosing spondylitis. Rugger jersey spine, chronic renal failure more than osteopetrosis. Causes of ivory vertebra. If you have to choose one, Paget's. It can also be seen in lymphomas, tuberculosis, medulloblastomas, metastasis, hemangiomas, bone-forming tumors like osteosarcomas and osteoblastomas. It came in PGI where only Paget's was correct, but can ask anywhere. Hyperostotic disorders like candle dripping disease or Mel or eostosis. This is something that can be asked as if on the surface of the bone candle is dripping, candle dripping disease. Or you can have spotted bone disease, again an incidental finding. This is also called as osteopoikilosis. Or you can have striated bone disease. Called as osteopathia striata. Striated vertebra, hemangioma. The entire skeleton, osteopatha striata. Many a times they talk about pectus excavatum, where the sternum is inside. That is seen in premature child, heart defects or some syndromes like Poland syndrome, like Marfan syndrome, like Noonan syndrome and homocystinuria. Because of inward sternum, the functions of the lung are decreased and there can be a history of mitral valve disorders. Pectus excavatum or inward sternum.